Hello, and thank you for joining us tonight for our free webinar, An Integrated Approach to Treating Sleep Conditions, panel discussion featuring Dr. Damiana Corca, Daniel Bernstein, and moderated by Chad Bong. My name is Jeff Bloom, Education Marketing Manager here at L.A.C. OMS. For over 40 years, L.A.C. OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. We recommend viewing the webinar in Chrome, Firefox, or Safari, as you can experience slowness in other browsers. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of the guest speakers, please use the Questions tab. And since tonight we have 2 speakers, if the question is for one of them specifically, please make sure to say who it's for. And then please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand, as well as some slides and handouts from our speakers. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From sports acupuncture, Chinese herbs, to practice management, you'll find something interesting for every practitioner on the L.A.C. OMS blog. I would also like to mention a few new great features at L.A.C. OMS. We just launched our new direct dispensary program to allow practitioners to recommend products to their patients and receive a commission on those purchases. We will share a link in the chat to our blog where you can learn more on how to access this program using your current L.A.C. OMS account. We also now have the ability to receive text alerts about inventory updates and other important details. All you need to do is text the word SUPPLY, S-U-P-P-L-Y, to the number 855-358-3253. And Carl will go ahead and put that into the chat for us right now. Now for featured speakers. We are proud to introduce our panel. Dr. Damiana Corca is a doctor of acupuncture and Chinese medicine and a functional medicine practitioner. Dr. Damiana has been in practice for 10 years, and she has been solely focusing on sleep disorders for the past 6. She had an inclination towards treating sleep issues since she started her practice, and then in 2011, she discovered Dr. Hamid's book and system on treating sleep disorders with acupuncture. Dr. Damiana has been teaching a 45-hour specialty class on sleep and acupuncture every year since 2015 at Southwest Acupuncture College in Boulder. And she's currently in the process of writing a book on insomnia and root cause healing, which will come out by the end of 2020. Our next guest is Daniel Bernstein. He is a working acupuncturist in New York City since 1995. His 4-year training entailed a meld of Japanese-style acupuncture and classical herbology. In 2005, he began studying trance work, which is Erickson hypnotherapy, and by 2010, he was battling sleep-related issues. His weapons of choice include Chinese herbs, acupuncture, and hypnosis. In 2016, Dan decided to try and codify the tools he had gathered over the years so that the layperson might sleep better and begin to access their inner healer and utilize acupuncture. His book, released this past February, is titled Rewired for Sleep, the 28-Day Insomnia Repair Program. While written with the listener in mind, it is a stew of East-West techniques that can be useful by any practitioner who encounters insomnia and anxiety in their practice. And lastly, our moderator, Chad Bong. Over the last 9 years, Chad has taught at the Southwest Acupuncture College, One Institute, and Tri-State College of Acupuncture. His classes include sports acupuncture, physical assessment, clinical mentorship, and palpation. He has also taught continuing education classes on orthopedic and sports injuries. Chad has always been interested in sleep from a sports performance and recovery standpoint, encouraging his patients to change some of their training hours for more sleep. For most of his life, he has prioritized sleep and has been gifted with 7.5 and 8.5 hours of sleep per night. And then kids happened. After the first kid, sleep was not dramatically changed, but quickly found out what it is like to live and work on short sleep after the second child recently arrived. Coffee intake went from being a fun tool for teaching days or daring to focus to multiple days a week to craving it daily. So please join me in welcoming our panel.
Hello, everybody. Just want to read something from Matthew Walker's book, which is called Why We Sleep. And it's kind of was part of my motivation of getting so excited to sleep and trying to put this thing together. And I think it's just kind of a fun little statement. Scientists have discovered a revolutionary new treatment. It makes you live longer. It enhances your memory. It makes you more creative. It makes you look more attractive. It helps you slim and lowers food cravings. It protects you from cancer and dementia. It wards off colds and the flu. It lowers your risk of heart attacks and stroke, not to mention diabetes. You'll even feel happier, less depressed, and less anxious. Are you interested? If this was a pill that was coming out from a pharmaceutical company, we'd all be trying to buy their stock because it'd be shooting through the roof. So all you really need to do is sleep to get those benefits. So I wanted to pull together a group of people who could talk about sleep and try to help us fine-tune our ability to treat people for sleep issues. So we're going to get started. And first, we're going to go to Damiana, and she's going to give us kind of an overview of how she thinks through this and where she wants to go with it. And then after she's done, then Daniel will take a shot at a little bit of a lecture, and then we'll do some questions that I have set up, and then we'll open up to questions for the audience, and we'll ask those questions. So, Damiana, do you want to get started here?
Sure. Can you hear me?
Yeah, I can hear you.
Perfect. So, hi, everyone. Thank you for being here today. I hope you're all easing into your practices and to helping your patients. It has been interesting in the last couple of months watching patients and friends and family and how this quarantine has changed their sleep habits and such. I personally have been sleeping more, which is such a blessing, and it's amazing. I know some of the people that I know, and I bet some of you, it hasn't been much of a break. Perhaps you have to homeschool your kids or just simply caring for them 24/7. So the picture can look quite different. Sleep is very important for the immune system function, as we all know. And I see this in my chronic insomnia patients. I believe that one of the things that happens is this kind of immune system cells, they get replenished at night. There is so much talk about cytokines. They do get replenished at night. So in Chinese medicine, I think it has more to do with Wei Qi and that shift that happens at night when the Wei Qi goes deeper in the body and the nutritive Qi goes to the surface and such. So we're not going to talk a lot about that or much about that today. Hopefully we're coming out of this. So I do watch my patients when they suffer of chronic insomnia. If they have like 3 terrible nights of insomnia, they start feeling sick. Many times they actually don't get sick, but they say they feel as if they're getting sick. And then if they get a better night, thankfully, it goes past that. So that's very, very interesting. So, and I think this is when we're sleep deprived and we feel like we're getting sick, it's kind of like a protective mechanism because the body is trying to do anything in its power to slow us down so we can heal. So every discomfort and every kind of disease, in a sense, it's our body's best way to protect us from the most important functions and assure survival, really, no matter the cost. So even if that means being sleep deprived and then getting ill, and then you have to lay in bed a few more days because you're ill, and hopefully you'll catch up on sleep. So today, this is what I will be covering. We'll learn how to keep a sleep log. I feel like that can really change the patient retention and help you really understand the type of insomnia and then watch for the progress. Then the second part, the middle part, look the difference between the quality and the quantity of sleep and how it relates to the extraordinary vessels. And I know we're told that quality over quantity is important, but actually both of them are really important. And then the last part, learned how to identify the root problem of an insomnia patient in the first session and better communicate a healing prognosis for the patient. So we probably already do that to a certain degree, but I just wanted to highlight a few things for you. So let's start with the first part. As an acupuncturist who, I specialize in sleep issues, so this is everything I see every day. Every patient that comes in has some kind of a sleep problem, and it's usually insomnia. Sometimes sleep apnea, sometimes restless leg, but there is some kind of a insomnia, sleep-related problem. So I feel like this is one of the most important steps, keeping a sleep log. There's a few important things. First, it brings the awareness of what exactly happens during sleep. So having the patient keep that log sets up a really good baseline. So, I mean, I take really good notes at the first session, and then when they start every week keeping that sleep log, we can see the baseline, and then it builds from there, right? So that is crucial, especially for chronic cases, and for a few reasons. I bet you've seen this too. People forget. They come back in a few weeks after you've been treating them, and they're like, wait, what pain or what sleep issues? I sleep just fine. Since patients come to me for insomnia as the main complaint, that usually doesn't happen. But they usually, what happens in my experience, they kind of forget how bad it is. And so we're 6 weeks into the treatment and they're not sure progress is happening. That sleep log really helps to look back and say, hey, right now you're sleeping better 3 days a week. Yet the other 4 are not good yet, but you see the difference is building gradually. And so, or I've had this happen too. The patient comes in, they used to have a lot of trouble sleeping every single night. Then they have 4 really good nights followed by 3 bad nights. So when they come in, they're exhausted and cranky, and they simply forgot about the 4 nights. And so the moment they see it on the paper and realize it, it softens them up. Even though they're suffering right that moment, they look at that piece of paper, they don't feel as desperate. They're like, okay, I'm gonna keep doing this. I see it's helping. It just so happened that the last 3 nights have been particularly bad. So I explained to them, how it's gradual, and you probably saw already and such. It doesn't work like a sleep drug. It's more of a gradual progress, and having that sleep log is really helpful. So I rely on that sleep log to see what I'm going to do next, because the time of the night when the patient wakes up is really important, and that changes the pattern that I treat in a particular week. The first treatment is usually obviously based on what they're telling me and the symptoms and the tongue and the pulse, and then the following weeks from there, I kind of follow what they say on their sleep log. Let's say they have a lot of trouble falling asleep this week, not so much waking up early in the morning, then I listen to that and I add more. And if they don't keep a sleep log, people forget sometimes. So I find it quite valuable, and I would say most of my patients keep that. So let's see. I think I can go to the next slide here on how to keep that sleep log. I do have a template, but honestly, I almost never use it. I actually don't remember last time anybody asked me for it. I usually, I encourage people to do it their own way, because if they find what works for them, they usually are more compliant. So I tell them at the first session, just be aware of your sleep. And I don't want them to be aware a lot more or less. I just want them to do whatever they've been doing so far. So no more or no less. So trying to keep the stress down around keeping a log and what that means. And then whatever they remember the following morning, I tell them to write it down. So they may keep that log on a scrap paper. Usually people sometimes come in with like a tiniest piece of paper, and that's what works for them. And sometimes they have a notebook. Sometimes they keep it on their phone, which is really convenient because they can't say they forgot it. It's right there. Everyone has their phone with them. And then I get the patients that love their Google Docs and they do it color coded, and that's great, So whatever works, I tell them to do it. As long as they do it, that works. So then when they come in, and I find about all the different symptoms, that's when I tell them what to write in the log, because everyone is different, right? So if they have trouble of falling asleep, I just tell them, you have trouble falling asleep. note when you had trouble. How long do you think it took to fall asleep without necessarily looking at the clock, but just approximately? Did you take the medication? You didn't. Did you take melatonin? You didn't. Did you feel groggy and then like had a second wind and realize you should have gone to sleep earlier? All these little details based on what they told me on that first session. And then as they come back every week, I keep adjusting it. Or if they wake up in the middle of the night, I want them to notice, did I wake up because of a hot flash or not? Or did I feel like I needed to urinate first? Or because I was laying there, then I thought I should go urinate anyways. Like all these little details are really important. If they wake up early in the morning, or they groggy and west, or they fully wide awake, do they have racing thoughts or anxiety or none? They're just really peaceful but wide awake. All these little different details are quite important. So let's see what is next. A couple of things that could go wrong. By the way, that's my dog. When almost exactly, let's see, actually it's going to be his birthday on Friday. He's going to be 10, but right here he is 3 months old. He's just the most amazing dog. I thought I'd put him right here so you can see him, just because. So anyways, going back to what we're talking about, I try to talk to everyone about not overwatching the clock. That can really bring the anxiety up. But the first week or two, because the time of the night they wake up is important, I tell them to just do the same. If until now they used to watch the clock once or twice, just keep doing that for the next week or two. And then once a better idea what is happening, what time they wake up, I generally, mostly like everyone, 100%, I tell them to do their best and not watch the clock. So if people, especially if people have, those lighted clocks, they just open their eyes, it's right there. That's the most dangerous thing, because it just brings anxiety up. It's so easy to look at it and such. So I tell them to just let it be. It doesn't matter what time it is. For that reason, I also ask people to put an alarm clock because then they don't have to worry, like, how long has it been? What if I don't wake up? Even if they think they do. So that takes that fear out of there. If they've been awake for a while, half an hour, and they just really wonder what time it is, I tell them it's okay, just go ahead look at it. So it's not a big deal. So I don't want to be too strict either way, in a sense, but kind of guide them. Also, some people become, if they're kind of hyper or a little anxious, they will become stressed about, will I remember everything? Oh, I should remember. I woke up and I felt this way. And I tell them to just, it doesn't matter what they want, as long they write down, as long as they write something in the morning, whatever they remember, that's perfect. So that's plenty. And then you can't make everyone keep one. If they don't want to, they don't want to. It's quite rare in my practice. I mean, this is why people come to me. But I talk to them about how beneficial it is. But again, if they don't want to, pushing people is not helpful and creates more stress in the treatment room. So that is that. Also with, let's see, with the sleep log, I actually ask people to log other kinds of things like the menstrual cycle or foods, or usually with the food, it's only for 7 days and such. So other things that are, or even GI symptoms, if they have GI symptoms, I ask them to keep those, especially if I feel like it's a pattern that's related to their sleep problem. And for the food log, I do have one that I give just because it's a little more complicated. It makes it easier, especially because with the food, I just ask them for 7 days. That's usually plenty of time. All right, so let's go into the next section. I kind of wonder, like, what time did we start? 15 minutes ago? I'm sorry, how long ago?
6 minutes to go about.
Oh my gosh, I better get going, even though I have.
It's all right. I won't be too tough on you.
Okay, thank you. Oh my gosh, see, this is my problem. I can talk forever. Just always find something else to say. So let's go into this area here. So this work is based on the work of Dr. Hamid Montakab. He's an MD and an acupuncturist in Europe. He wrote a really amazing book that came out in 2011. And it was right when I started thinking about focusing on sleep. So his work is quite unique and valuable. It is a fairly different concept, or I should say nothing that I really learned when I went to acupuncture school. And that's the class that I teach at the acupuncture college. So there is a lot to that book and to sleep. And in that class, I actually just teach acupuncture and sleep foundations. So in the simplest way of looking at sleep, we look at the quantity of sleep and quality of sleep. And as I said earlier, I know that in general we think, well, quality is important, but actually they're both equally important. So it is more about identifying which one is affected or if both, and then looking at which part of the night is affected, which will tell us about which organs are affected from the Zhang food perspective. And that's not something we can get into today, obviously. There is a lot of information, very little that can be covered in 20 minutes. So anyways, when we think of the quantity, we're referring to the length of the sleep. So for example, if a patient has trouble falling asleep from, let's say, 10 p.m. to midnight, they simply cannot fall asleep. When, some nights they do fall asleep at 10, and then that's the length of the sleep that has been affected. And the same way, if they're wide awake in the middle of the night for an hour or two, then again, it's the length or the quantity, and that relates to the extraordinary vessel in Chow. And then if we look at the depth of the sleep or the quality of the sleep, that is patient is often not fully awake or comes in and out of sleep. Sometimes they will tell you that they don't sleep, and you have to ask them, what do you mean you don't sleep? They say, well, I can't fall asleep for a few hours. And when you ask them a little more, usually just ask them like blankly, like, do you think you doze off sometimes? And they're like, oh, maybe I do doze off sometimes. We'll wake up commonly at 3, 4 a.m. and they say they can't go back to sleep. And then you ask them and they say, well, actually, I do doze a little bit, but it's not good quality sleep. So that is when with this is the quality of the sleep, and that's the in-way. And that was, I guess it's on the next page here. Let me put that. Here we go. So in-chow regulates the time, as we just said, and then in-way, it's the depth of the quality of the sleep. So if you think about it, insomnia is a yang disorder because of an in disturbance, right? You're awake and active and restless as opposed to being still and asleep. So that is why treating the in-chow way as opposed to their yang counterparts is what gives the results. And of course, the yang counterparts can be affected. I mean, yin and yang, right? The connection there, we can't say, but in general, I see more how the yins are more affected. And we palpate the she cleft of the extraordinary vessel for both the yang and the yin counterpart. So that's how I know even from Dr. Hamid's book, but also from my practice, a lot more. I see tenderness and nodules and softness in those she cleft of those extraordinary vessels. So when the quantity of the sleep is affected, we choose kidney 6 to needle. And again, we base that on symptoms and also palpating the she cleft. And then the same way we use 6 for in-way, and then that's the master point of the, and we palpate kidney 9, the she cleft. So let's see, we can kind of skip here since I'm running out of time. I might as well go to the last part here. So I just wanted to kind of split the levels of severity of the insomnia in 3 parts, just to make it easier for you when you do see patients in the clinic to kind of, I know you do your diagnosis and you look at the tongue and the pulse, but this will also give you an idea of like, yeah, this probably 6 sessions might be enough, or like this is 3 to 6 months or longer, just based on what else is happening with their health. So there is the acute insomnia generally, and likely these patients are already seeing you because, most patients when they have an acute bout of insomnia, unless they've experienced insomnia, they don't think acupuncture insomnia, they think insomnia and drugs, insomnia and melatonin, insomnia and sleep hygiene, but the first thing that comes to mind is not acupuncture unless they know you. So usually for this, it got triggered by probably emotional stress or poor sleeping habits or some acute toxin exposure or even jet lag, something along those lines. And just a few sessions make a difference, probably 4 to 6. Sometimes people say, a couple of sessions is plenty. And just a quick note, always watch for those cases. If it came abruptly and it's really severe, sometimes it can take months. Something got so disrupted so deeply, right, that it might not be, it's acute, but it might not be as easy as a couple of treatment sessions. So you have to kind of try to identify that so you don't lose them as a patient. All right, and then the second level, it's like what I most commonly see in the clinic. It may have started gradually or suddenly, but they may have it every single night. It might be most nights, or it can be certain parts of the month, with the hormone changes. They may have GI issues, could be chronic stress response, or even sugar imbalance. I think it's a big one. And the patient might get relief after a few sessions. I always kind of tell people, like, we should see changes around third, fourth, fifth session, but gradual changes. And those people usually have to treatment for at least sessions and then some maintenance after that. So I kind of prepare them for that. That's kind of the most common thing that I see in the clinic. And then there is the third level, which is chronic insomnia. They'll tell you things like, no matter what I do, I can't seem to sleep, or I take something and it helps for a few days or a week and then it stops working, or it has been going on for years. They may be chronically ill with other symptoms. And sometimes these people will fall into that second category. So it might not be as bad as we think it is. And, acupuncture and herbs are simply amazing. So that might be it. But I really want you to watch for those cases because, there is a reason why they say nothing really works. It probably because it doesn't. There's probably a bigger problem. So I see this with chronic GI infections, with mold toxicity and Lyme and reactivated EBV and heavy metals, and then the sleep apnea, which it's underlying everything. And so that could definitely be a problem. So do what you do best. Educate your patients, and where insomnia is a symptom, not a disease, and take it from there, and you'll do wonderful. And I think I'm almost done. So yeah, create expectations with patients. Make sure you tell them it takes a while. Kind of watch for those levels, and educate them that it will be gradually, but likely within the first session you should see some changes so they can see the light. If you tell them this is going to take 6 months and you're probably not going to see any changes in 3-4 months, that's kind of hard, So we know acupuncture is amazing. Likely they'll see some changes, even if slight changes at the beginning. And I mentioned sleep apnea. I made a handout for you. It's a brief handout. It's 4 pages, but it kind of goes over some important things as it relates to sleep apnea, and I think you're going to find it helpful. And that's it. Thank you for listening. And I think I went over time a bit, but
no problem.
Thank you.
All right. Thank you very much, Damiana. It was great. Daniel, are you ready to go?
I guess I am.
Jeff,
Okay.
Are you ready to switch or is it just the next slide? There we go.
Great. I'm going to give this a shot. Let's see if it's working. Beautiful. Okay. Hi, I'm Dan Bernstein. Thanks to Lasha. Thanks, Jeff. Thanks, Chad, for allowing us to present. That was wonderful. Damiana, thank you so much. I learned quite a bit there. I'm an acupuncturist in New York City, and well, I treat everything, as we all do. I do specialize in sleep disorders. I got licensed in 1995, and in 2005 I began to study hypnotherapy as well as a secondary modality. And then around 2010 I began working with sleep disordered patients because I could feel that the two modalities together were quite helpful, and also along with herbs. And so the quote there, "Put your thoughts to sleep. Do not let them cast a shadow over the moon of your heart. Let go of thinking." I like that quote a lot. It sings to me. It's elegant. It's very poetic, and it gets to the heart of what I see in sleep disorders, which is an inability to let go of thought. And so I hold on to that quote a lot. Today's goals, we're going to talk about the importance of sleep, acupuncturists as Sherpas, treating insomnia, a case history, and then something that I call mind traps, and then finally an exercise that we'll do. So let's get to it. So what is healthy sleep? I really began thinking about this when I first started writing my book. And the reason for it is that we tend to think that we're supposed to get 7 to 9 hours a night. And I think we all have that, I would call it a misconception. And it wouldn't be so bad except for the fact that those people who are sleep disordered start judging their sleep against that supposed ideal. And the idea of parceling sleep via time is really a pretty much of a recent idea. And it's a construct of the Industrial Revolution. It wasn't until, vast amounts of people had to get up at 6 in the morning to get to work by 7, work those 12 hours and come home and, get their food and start all over again. And the truth of the matter is that throughout history, what has been the truth of it is that we've had first sleep and second sleep. And we can go back to classic books. Cervantes' Don Quixote talks about it. And what that means is that a person would maybe go to sleep at whatever their hour was, perhaps at sunset, and then wake up at 1 o'clock in the morning. They would get up, they'd feed livestock, they might talk, have sex, eat something, and eventually just go back to sleep and then wake up at their normal time. And so what has happened is that as we don't know about this, we tend to think that if we wake up in the middle of the night, there's something wrong with us. And immediately cortisol levels tend to spike. We become anxious. We think there's something wrong. We failed at sleep. And this creates a whole cycle wherein we're unable to go back to sleep. Whereas in other times, in past times, and I tell patients this because it really is eye-opening to understand the idea that it's okay to wake up in the middle of the night, that for many people it's the natural way. And another problem is the advent of artificial lighting, which came along with the Industrial Revolution, I believe. And so before that, we would go to sleep at night at sundown, and we wake up with sun up. Now with the advent of artificial lighting, our circadian rhythms got all screwed up. Our hormonal levels were completely messed up with it. So that's something that we can work with. Obviously, just turning off all those LEDs at night, getting them out of the room, putting something over them, even clock, really helps because we really need that absolute pitch blackness. So again, as Damiana spoke about, it's not how many hours sleep, but it's the quality of the sleep. And I just tell people that if they wake up in the middle of the night, they can talk to themselves. I tell people that, of course we work with them. We might give them Tianwan Bushindan. We might give them something for the middle of the night that treats either yin deficiency or blood deficiency. But I also tell them to take a couple of deep breaths and just say to themselves, it's okay if I sleep. I can just rest. And they can just, talk themselves down by taking a few deep breaths, and just saying that has the effect of engaging the parasympathetic nervous system. And it's also a basic form of self-care that the body and mind really need at that moment. So again, I'm going to quote I'm also going to quote Dr. Matthew Walker, author of Why We Sleep, because I guess it's almost seems opportunistic now, but it's also very apropos of what's going on right now. The idea that a single night of poor sleep can damage our immune system so violently, where he says a single night of poor sleep can impair natural killer cells activity by as much as 70%. And they are crucial They're the first line of defense against cancer cells, microbes, and other potential threats. So in the short term, it can put us at risk for developing acute illnesses like colds and flu, but in the long term, it increases our risk for much more serious threats. And so what this whole COVID situation calls up is the idea that having our immune systems at peak is so crucial. It's not only scary, but it's really a call to arms to do what we can to get a good sleep, even as practitioners, so that we don't burn out. And I wonder if anyone out there who's listening has ever burned out on this gig. I mean, I have. And I think it's hard to do acupuncture without burning out at some point, or certainly getting close to it. And if we do that, we're diminishing our immune system, and we're also not helping others. So I always tell acupuncturists to keep your immune levels at the peak possible. And it's the idea. This idea in particular brings to focus the quote from the Neijing, which says something like, "There aren't 495 diseases. There's only one, and that's the poor flow of qi." Something like that. Don't quote me. So some basic sleep facts. I bring up these facts and percentages because I always find it fascinating that here we are. We have insomnia that impacts 44% of the populace. That's 4 in 10 people. And yet it's interesting that there's so few of us that actually specialize in it. And I understand that it's not a kicky form of treatment. It's not something where we can, with tan and tongue out there, patients feeling better before they're even off the table. And this is a gig that requires patience, not only for the practitioner, of course, but for the patient. And as Damiana said, we have to communicate that this can take time, that, and it's the kind of thing where, patients listen, they're desperate. Very often, if they're chronic, and even if it's acute situations, they feel like their world is coming to an end. I mean, I've had people who were suicidal because sleep was impacted, and they had not been that way at all before. So communication is absolutely crucial. That yes, we can do amazing things, and no, it's not going to happen yesterday. And we also, I'm sure Damiana does as well as I do, I get people who are on sleep aids, as they're called, and they've been on them for months, sometimes years, and the problem with them is that they don't help you. They don't take us, we have 4 stages of sleep, and where the stimulation of immune system happens at stage 3 and stage 4. So sleep aids don't get to that. They typically take the person down to stage 2. So it's really up to us to become part of the healing mechanism for people who are having problems sleeping. So, and I use this term acupuncturists as Sherpas. It's, I believe, our job to really communicate, to help people on their journey, to help themselves. Of course, we have, Chinese medicine, but I do believe that a large part of the work is having people do the work themselves, okay, to become mindful of how they're sleeping, when they're sleeping, and to begin to give them exercises that they can do. Now, I know most people don't really like exercises. God knows my patients are not in love with them. And yet, I do believe that part of the process, and it's core to Chinese medicine. I mean, from the beginning, it was always, well, you're going to fix your nutrition. You're going to start exercising. You're going to start meditating. And if those don't work, well, okay, we got acupuncture and herbs for you. So there's a part of me that wants to go back to that original modality that says, here, I can help you, but you can help yourself even more. And, sometimes it takes them out of their comfort zone to try the damn exercises. Sometimes I have to twist their arm, but that's okay. To quote humanly, we're only human. And yes, I'm that old. Moving on. Acupuncture for sleep, phase 1. So the way I work is I begin a session with a root treatment. And so I use various modalities, the 5 elements. I use ID and ED, internal dragons, external dragons, aggressive energy, Buddha triangle. I may use extraordinary vessels. Again, as Damiana mentioned, either the ways or the chalice, sometimes Ren and Do. I'll do a Japanese style treatment. I'll check for adrenal depletion, blood stagnation, or sympathetic dominance, and then treat from that place of the hara. And then I'll use balance method and master tongue because they're both rooted in the I Ching and 5 elements, and for my money, they're both root and branch treatments. So I was going to go into a whole song, and it's about how the classic of difficulties, the Nanjing, talks about doing root treatments. And in the classic of difficulties, actually, in question 77, we're told that the mediocre worker, which, ouch, chases after the symptoms, but that the so-called superior worker chases after or goes after or treats what is healthy. And the example given is that rather than treat a diseased liver, the correct strategy is to tonify the spleen, which we know is often affected when the liver is on one of its rampages. And that's those root treatments are done on the level of the 5 elements in the extraordinary vessels. So typically I will begin with one of those treatments. So I begin by treating the underlying imbalance, and I treat the presenting problem. And in my practice, since I also do hypnosis and NLP, I may do that as the second phase, but I almost always begin with the underlying balance, the underlying imbalance, the root problem. And by the way, if you could just give me 5 minutes when I'm close to, how much time do I have? May I ask?
You're all right. Just finish.
Cool. All right. All right.
I'll cut you off if I feel like I need to.
Got it. Thank you. So in my practice, you know, as I mentioned, I do hypnosis, and that's essentially a different modality. But again, I sometimes do what I call hypnopuncture, which is treating first the root and then going on to working with the mind. Phase 3, I may prescribe herbs or targeted supplements, even CBD oil if it's warranted. But very often I will go to homework. I will give the patient, whether they initially want it or not, I will offer to show them a way that they can help themselves when they cannot sleep, because I'm not there to help them. And, you know, the acupuncture with chronic pain, as Damiana said, it can take months. And I don't like to give them a wing and a prayer to hang on to, because sometimes people are desperate enough and they are not, you know, no matter how good I explain it, no matter what convincer I may use, people are not trusting. They've been to every doctor, they've been to every specialist, they've been to functional doctors, they've been to the chiropractor, they've been to their naturopath. And I like to say that very often acupuncture is the caboose on the train. And, you know, given half a chance, we're champs, but we need to be realistic with those people, with the populace, and let them know this can take some time. And the herbs I do think help with that process quite a bit. So here's a case. And it's a simple one, or as simple as insomnia can be. 34-year-old woman complained of waking up during the night. This was a case of depression, okay? She was sleeping throughout the intake, depressed for no reason, feeling out of control in her life, thoughts swirling around in her head constantly, including regrets, feeling overwhelmed by life in general, not uncommon. Pulse wiry and thready, particularly weak on the heart position, tongue red with little coating, okay? Palpation, pressure, pain along the liver channel 4 to 8. So I diagnosed that as heart yin deficiency with liver qi stagnation. Did I just get kicked off? Can you find me? Let me see now.
We can still hear you, Daniel.
Okay. Okay, great. Sorry. I got a weird mess there. Treatment strategy, okay? Acupuncture, herbs, and homework. So as Damiana mentioned, I could open the yin way with PC6 and spleen 4, and then follow with a good, was that a 5 minute? No. Follow with
you're at
5 minutes. Good, thank you, perfect. So I could follow with a TCM, beautiful treatment. Those guys work beautifully. In this case, I chose to begin with Buddha's triangle. It's a 5-element treatment, I believe. So on her dominant hand, I inserted right P6, heart 7, long 9, and it creates a perfect little triangle. And then an extension, which is not part of the original treatment, is on the opposite foot. I inserted liver 4, spleen 6, and kidney 3. So you had a beautiful contralateral yin treatment. So that was a beautiful root treatment. 15 minutes later, I came in, I added Do 24, along with left ear Shen Men, right sympathetic 0.0, tranquilizer, spleen 9, and yin tong. And that was the yang version. So I love to do the contralateral treatments, which is something that I was studying with Kiko Matsumoto, where Dr. Kawai would do what he called infinity treatments, which he would use iron pumping cords and do a figure 8. And Dr. Tan used a lot of those same figure 8s, going yin, yin, yang, yang. Beautiful treatments. Again, with Lori, I went with a herb formula. I could have used any. I went with Gamai Dazao Tong, licorice, wheat, and jujube decoction. And again, as the writing, I use it often for people who feel out of control in their lives, or in fact do feel are out of control. Nourishes the heart, calms the emotions. For people who can't stop crying, I suggest they take half a dose every half hour until they calm down. And finally, I gave Lori a simple exercise to do at home called the 5, 5, and 5 exercise. Before I get 5 and 5, 5, I want to just mention this this little list that I have, and I call it mind traps, aka sleep killers, which sounds like something out of the New York Post front headlines. And I consider myself a sort of you've heard of serial killer profilers. I consider myself a profiler of serial insomniacs when I think about myself, which is of course never. So these are the 5 things that people typically can't sleep over. 1, distractions. Did I walk the dog? Should I get up and pee? Did I take out the cat? 2, daily regrets. Why didn't I tell off my boss? Why did I send that funky email? Why didn't I exercise today? 3, real life problems, money, health, family, relationships, things that are crucial to our life support. 4, things that overwhelm us, not having finished yesterday's tasks and tomorrow's tasks looming before me, and feeling the weight of all of that. I mean, I'm on any given day, I can sign up for any one of those, and most acupuncturists, can sign up for 5 out of 5. So it's really an issue that we all have to deal with. It's part of the existential dilemma. And 5, difficulty disconnecting from phone, computer, TV. Again, it's that issue of the pineal gland becoming overwhelmed by light, constantly light. Turn it off. Finally, or semi-finally, this is the 5 and 5 and 5, 5 and 5 in exercise. I'm not sure where it comes from, but it really helps unwind the sympathetic nervous system. And I give it to a lot of patients who have those issues that I just mentioned, who can't turn off at night, who are stuck in worry, in resentments and regrets. And so the first 5 minutes, I have them just write down all that stuff that's in your mind, put it on paper. Then I have them fold the paper, place it aside, and say, these are tomorrow's worries. For the next 5 minutes, I have them close their eyes and gently massage yin tong 24 times in each direction. At the same time, I ask them to imagine that they're on a beach or a garden, a rainforest or a lake, or even in their home, or any place that soothes and calms them. For the last 5 minutes, I ask them to to basically do mindful meditation, to become mindful of the breath, follow its path with the mind down into the lungs, and jet back up through the nostrils, and just keep following it. And it tends to make a person feel really relaxed. They can do this before going to sleep, or if they wake up, certainly they can take their mind off the mind and into the body. And the person can always switch those components around. And I'm almost done. I just want to talk briefly about autogenic training. It was created by a German cardiologist in the 1930s who got tired of seeing his patients dying. And he came up with this calming technique so that they might regain control of their body and mind and thus reduce stress. And I have a recording of autogenic training on my website, rewiredforsleep.com. It's free of charge to listen to. It also has a script there if you decide it's something that you'd like to use in your practice to show to your patients. And that is essentially it. Again, thanks for letting me put some of these ideas out to you. And I encourage you all to really consider this incredibly important work that we do for sleep, because it really is the heart of it. Almost at the heart of the immune issue, as was mentioned before. Thanks again.
All right, thank you very much, Daniel. Now we're going to kind of move into the conversation / me asking questions to you guys, and then we'll get into the questions that the people have been asking. I see Damiana's been answering some of them as we went, but we'll try to get them his voice, kind of things too. But
sure,
people who are on here may want to go in and check out the questions that Damiana's been answering as we've kind of been going along. We'll try to get them to talk about it as well. So, Damiana, when you were talking about using the extraordinary meridians, yin chao mai, things like that, are you combining them at all? Or are you using them with, say, the Ren meridian or Chong meridian or anything like that as well? Or is it pretty much just in the way you described them, for if they're getting, their quality of sleep versus their length of sleep?
Yeah, I know some practitioners always pair them, but I don't always, and it still works, especially if I need to, it's just too many points. I like to keep it simple, but in some cases, and most of the time, if there is, trouble falling asleep and then there is menstrual issues, like I will, of course, use Chong as well and such. So not always, and it still works.
So if you were going to link the Yin Chao Mai and the Ren Mai, how are you doing that needling? What's your...
I also don't have a specific order, no tricks, just needle the point.
Just
usually
needle.
Start at the bottom and just go up. But I do the Chao Ren and then move on to other things.
That's what you start your treatment with, essentially?
I always start my treatment with the extraordinary vessel for sure.
Okay. So the questions came up for me while we were kind of cruising along, and some melatonin got brought up. What do you guys feel? Is it helpful? Is it not helpful? I know, or is it helpful for certain things like say jet lag or something like that? Let's go with Daniel first, since Damiana answered the last question.
Sure.
We'll go back for.
I do think it's helpful for certain people. Certain people, it actually brings them anxiety. So, and the interesting thing with melatonin that I found is that sometimes even if you feel like, oh my God, I need the biggest dose possible. Well, no, started with an incredibly low dose. Matter of fact, some of the most effective melatonin that I found for people who want to take it is, I hate to tout anybody, but Trader Joe's has 500 micrograms, which is half a milligram. And I've had people tell me that was the most effective one for them when they use melatonin. Again, it's not for everybody. It will give you vivid dreams, to say the least. So,
yeah, the first few times I ever took melatonin, I had very vivid dreams, actually. So I stopped taking it for a very long time. And I've dabbled with it here and there. I'd say that it's dramatic for me one way or the other. But if I feel like I need to really get some sleep, I do definitely try it. How about you, Damiana? How do you do anything with melatonin? Or?
I don't do much with it just because everyone that comes in has already tried it and they say very little or not at all. But I definitely recommend it for jet lag. Also, I'm up there with the low dosages. I didn't know about that, but I asked them to get drops, and drops usually come as low as usually 1 milligram and such. It is an antioxidant, so there is research around that. How to get those properties? You have to take high dosages, like 20 milligrams. I never advise anyone to do that, but I have functional medicine practitioner friends who do advise their patients. So you can look into that. Not something that I tell my patients, but certainly something that's out there and people advise.
So Daniel talked a bit about sleeping pills, sleep aids, whatever, and most of them being essentially sedatives and essentially sedate your brain. And sedation is different than sleep, natural sleep anyways. So I'm assuming that the goal is to get people off of these things with you guys, if they are on them. I'm struggling with that much insomnia. I'm sure they've tried them. So how are you having that conversation with your patients? Like, how are you trying to help them wean themselves off or get themselves off, or what's the kind of process here? Because some of them can have rebound sleep issues afterwards, right? So they take the medications, they stop taking it, and then they have a couple of really horrible night sleeps because they were on medication. So how do you kind of talk them through that? What, is that a goal for you guys?
Well, for me, it's a big topic, and it's not a pretty one, because basically people, I always tell them, first of all, do not just stop taking pills. Okay, that will be a terrible option. If they're willing to make a commitment, I tell them to really, it can take 3 to 6 months to really get off something like Ambien. It can take a year, truthfully, but I have a protocol, which is basically every 21 days, chop off an eighth. And I find that that's the least radical, the least violent way of doing it. And that way, typically it will help after 3 to 6 months, but definitely not to go, I hate to say, most MDs say, yeah, just go to half. No, go slowly, go gently, and that way it allows the Chinese medicine to start becoming the substitute that is really necessary, but not to do so violently. Otherwise, they'll just stop coming. It's my experience.
How about you, Damiana?
Yeah, but the same thing. I asked them not to change anything and talk to their doctor, because we're not the prescribing physician, obviously. And then I tell them we're only going to make changes to the medication once you start sleeping well with the medication. And then from there on, whatever small doses we decide on, or they decide with their doctor, and go even slower. They usually advise them to go slower than whatever their medical doctor says. The hardest that I found with people trying to come off is Klonopin. Some people get on and off like no problem, and other people, it literally makes them crazy. Like they can take a year or two. It's incredible. And Valium and some of the benzodiazepines and such. So yeah, gradual, and then once they change the dosage, if they can bear it, if they experience some insomnia, I tell them to stay there, and we do a few more acupuncture sessions. Then again, when they're good with that dosage, make it lower again, and then again we watch what the body does until they're completely off.
How about some of the stuff that people are like self-treating themselves with, like say antihistamines or Benadryl or something like that to get themselves to sleep? Should they get off that stuff? Is that going to cause them any problems? What happens to the brain with antihistamines?
Oh, well, I try not to exactly.
Really?
And all of that, but I try not to scare them, because that's the least thing that they want when they come in. They're trying to sleep. They want to sleep. That's why they're in my office. So I kind of educate them a little bit. Some people don't know that antihistamines increases the risk of Alzheimer's or dementia. And so I educate them about that. And then we look at what they're taking and we make priority. And they usually kind of know, like, I really want to get off this thing or that thing. So I say, okay, let's do that. Leave the ones that are least harmful at the end. Let's just try with one at a time.
Have a good antihistamine story. I was really having bad allergies, and I had to go to Boulder to teach with Whitfield Reeves. Flew to Boulder, Whit picked me up at the airport. We get to the 29th Street Mall in Boulder, which is an open, kind of walking around kind of mall in Boulder. It's pretty new. We parked the car. He had to go into the Apple store to get his something done with his computer. And, we both had all of our stuff. He got to the airport, I got to the airport, we drove together. And we had all of our stuff in the car. And I got out of the car and walked into the Apple store, left the car door wide open. He had his ukulele in there. He had I had my computer in there. He had like his iPad, all of our stuff was in there. Because it was Boulder, we came back, nothing was gone. We were for 45 minutes. We came back to the car. Everything was still in there.
Somebody left a sandwich besides, yes.
Yeah, it was crazy. All right, sorry for the distraction. All right, how about alcohol, caffeine, just sleep hygiene kind of stuff? What are you guys talking to your people about sleep, those kind of sleep hygiene things where we can, basic thing can do before we get to all the acupuncture treatments and things like that, that we can help people with? Or do you think the people who get to you have already done all that stuff?
They typically, sleep hygiene is the first thing people find on the internet. And so if they're not following it, they're kind of wasting their time coming to me. But typically they know about alcohol, they know about caffeine. Are they willing to make those changes in their lives? Sometimes I'm kind of forgiving with that. I feel like it's, some people obviously cannot drink a cup of coffee after noon and they're up all night, and that sensitivity has got to be, and they're usually, people come to me tend to be fairly self-aware so that they know that that's not an option. Alcohol is something that, people will do what they do with alcohol. I have rarely seen people say, "Oh, okay, alcohol, is not good for sleep. I think I'll stop drinking."
Yeah,
They've got to be pretty far along the way to actually make that lifestyle change. That said, sleep hygiene is a pretty good. I always give it to people. I say follow these to the best of your ability, because this is sort of the first level of helping yourself. Okay, these are the things that most cognitive behavioral therapists will talk about. Their doctor will give them a list of sleep hygiene. So they've usually been through that list by the time they get to me. Not always.
Damiana, take a shot at that one.
Yeah, of course. So I don't like to call it sleep hygiene anymore because it just sounds so,
overused.
I call it sleep foundations, and I tell them the truth. Whenever they come in, no matter how much they know, when I really take a look at what's happening, there is always a little tweak that we can make that makes a huge difference when it comes to all these different layers of it. So I live in Boulder, Colorado. It's a lot of healthy people. Generally, they're willing to give up alcohol, and they do often. It's amazing. I tell them to just do it for a month. They're healthy, very I'm going to do whatever it takes. Which is probably part of why they have insomnia, because they're just so kind of too much on and such. But but the winding down for an hour, I can talk a lot about that. That's really important. I really advise men to watch for that groggy feeling. People confuse the tiredness and the grogginess, and explain the difference. Being just tired and wired is one thing, but being tired and groggy, it's like what you're looking for, and making sure they don't miss that window. So really try to teach them to notice themselves in the evening, I felt sleepy, but it wasn't time, so I didn't go to sleep, and then I had more energy. People don't think about these things until we talk about it. That's important. And again, it's just a lot to talk about. And 10 a.m. is usually when I tell them to stop the caffeine. Some people ask them to stop altogether just for a month or two, and they do sometimes. So it just depends on the case.
Caffeine's got a half-life of 7 or 8 hours, something like that.
Yeah.
So if you take a cup of coffee or 2 cups of coffee at noon, at 8 p.m., you still have 1 cup of coffee in your system or so.
Yeah.
So if you take it later, then you have a cup of coffee in your system when you're trying to go to sleep.
I know, and we don't know these things how much, because it's not one thing. It's not just the caffeine or just alcohol that's causing the insomnia. It's just numerous things. So we want to eliminate little things that are confusing, and then once you sleep well, we can add them back up. With alcohol, some people are affected by beer, some are not. Some are like wine, and then if they sleep better in that, then back in they realize like, oh, if I drink just 1 glass at 6 p.m. I'm fine, but as soon as I go to 2 glasses, and if it's a little later, I wake up wide awake at 2 a.m. probably because of the liver problem or a blood sugar problem, whatever it is and such. So it's there is a lot to that.
So Damiana, you live in Boulder, which is definitely recreational marijuana kind of past and medical marijuana. I don't know, where's New York at in that? Are they medical marijuana yet?
I think it's not quite.
Pennsylvania, I think, is still, but you can't actually get any of it yet, I don't think. But anyways, whose phone's ringing?
My own.
So are you guys up on the research on marijuana, THC, CBD, what's happening with the sleep? I think Walker talks a little bit about THC. He said the research isn't there yet, at least when he wrote the book on CBD, but on THC, marijuana with THC in it. THC, I believe, is a REM sleep like limiter. Like it limits your ability to get into REM sleep. Is that kind of where you guys are at?
I mean, I like to, if somebody tells me, hey, if I don't smoke, I have a hard time sleeping. And if I do smoke, I tend to be out like a light, and they give me that look of, do you approve? And it's really, and I feel put in a bit of a vice, because I don't want to say, well, no, that's not, I have no issues with marijuana if that's what people want to do. However, the goal is always to sleep naturally. Obviously, it's to not have any of those crutches. And in terms of marijuana being a REM limiter, I know from my own past experience that I'd wake up groggy. I mean, there's, the brain, something is happening that does not put us at peak condition if we smoke. So again, I don't judge it. I just look at it as objectively as I can, which is ideally go with the natural flow rather than marijuana, which is semi-natural.
Damiana?
Yeah, I agree with it. I mean, I get a lot of people coming in.
No kidding.
No. And so I actually get a lot of phone calls from buyers. They'll see, I'm like, no, thank you. That's not what I'm doing. It can be helpful, but I don't recommend it. I mean, that's not why people come to me. So I watch people. I guess I have a lot to talk about that, but I watch people, they're not themselves when they smoke every day. It's like a different person. I've had a few people come off of it, and then it's like a completely different person that you're talking to. So there is research on that, and it's complex and it's controversial and all of that, but let's just say I don't use it. CBD, I mean, it can be okay. It's probably better than some drugs, I would assume. So, choosing for a while the better version, that may be okay.
Yeah, I mean, alcohol and marijuana kind of fall into the same thing of like, yeah, it relaxes people, chills them out, it sedates them a little bit, they fall asleep. So they're able to fall asleep faster or easier, or at least they feel like they are while they're partaking, but it affects their quality of sleep as far as I know. So it'd just be something that I would be concerned about.
Sure. And when people stop, if people are drinkers and they stop drinking, very often they have a problem sleeping. And so I sometimes get people who are newly sober and they can't sleep to save their lives. And they find that they, in fact, have been self-medicating with alcohol. And this is a fairly common situation. And so the work then is, well, it's not like getting somebody off Ambien where you can cut them down from, let's say, a full pill to 7/8 to 3/4 to 5/8. People who are newly sober cannot take just 3 drinks and be okay rather than the 10 that they were drinking. And so it's a different animal and a different challenge. And so that's where I really feel some of the more powerful 5E treatments come in, something like aggressive energy or the internal external dragons, where you really want to kind of shake them up. All
right, let's mix a little bit of east-west kind of concepts here. And do you guys do anything with lab results? Do you guys have them go get certain results taken? And then what are you looking for? And then do you see any correlation with certain lab results and then certain like Chinese medicine patterns that you might see all the time? Damiana, you can go first.
Sure. Yes, I do labs, thankfully. I find it really helpful. The main labs that I do are the organic acid test from Great Plains Labs. I find a lot of useful information in there. And then another one, I do a stool test. I do see sometimes relatively healthy people, they don't have many GI symptoms, but the patterns in Chinese medicine shows that there is an imbalance, stomach, spleen, and such. And then it's usually true. Like they might just show up some, deep spleen Qi deficiency, or maybe some stomach deficiency, and in the pulse you can see some changes, and then the stool test really helps identify that, with whatever pathogens may be in there and such. I also test hormones for women, usually use the Dutch test. It's a urine test. Sometimes if the people have money, combine it with a saliva test. And it's really helpful for me because, I know the patient may have some kind of indeficiency and heat, but then looking at the lab, sometimes it gives me a second confirmation of how big the problem is and where else to look and what kind of supplements I can add in top of the Chinese herbs and the acupuncture, because it can be really hard around perimenopause. Menopause is brutal, that's when women feel like there is nothing that can help them. So I want to be prepared for all of that. So yeah, kind of those are some thoughts. So the GI map I used, the organic acid test from Great Plains, and then the Dutch test, and then some saliva from ZRT. So those are labs that have been helpful. I also work with other functional medicine practitioners, so kind of interact a lot and help with the patients.
In New York, we really don't do labs, so it's outside of our scope. That said, I do see patients do bring me their labs, and I kind of am able to kind of go through them and ask questions, but it's not within our scope.
So another thing that Matthew Walker talks about is cognitive behavioral therapy for insomnia, being a pretty high success kind of thing. Do you guys agree with that? And if so, do you send them to somebody? Do you have a kind of built a real network in there for something like that?
Well, for myself, I do hypnotherapy, and I may be biased, but I consider CBT, cognitive behavioral therapy, hypnosis light. That's what, in other words, it's sort of, and I've had people who went to cognitive behavioral therapy come to me afterwards, and it's the only ones that I see are those for whom it didn't work so well. So again, I have a somewhat of a stilted view of it, but I'm not a big fan. I mean, there's a whole method of restricted sleep that CBT uses that it just doesn't work. It doesn't, where they force the patient to sleep only restricted times, no matter what, and it doesn't work with the way I work. And they use some good. Let me put it this way: of all forms of talk therapy, CBT is the best, and it still is not the sort of thing that I feel like hypnotherapy, trance work, Gestalt based non-somatic and somatic therapies, that kind that I do, are far more effective than what CBT does. It's my own take on it.
Not so different than when somebody comes in and asks me if whatever, physical therapy or chiropractic or something else works. I'm like, I don't know. I only see the people who tried all those things.
Right.
It didn't work.
Exactly.
So they're here. So
right.
I kind of get it. All right. Damiana, you're shaking your head
Yeah.
Nodding your head, I should say, for most of this. So
I have such a biased view, I mean, they come in because they probably tried that already because that's what's popular out there.
Yeah, that's first on the. It's much earlier on the list for a lot of people.
Right.
But exactly. It can be torturous for a certain category of people. I mean, seriously, if a woman is going through perimenopause, you're gonna enforce her to sleep 4 hours a night, and I mean, absolutely.
Really?
They do that sometimes. That's why I feel like I have a little bit of a hunch. I mean, I know it works really well for some people, but also like don't advise it for everyone. Which some of my patients come in and they cry and they're so frustrated. They say, well, let's try this. And it's just like, I tried for a couple of nights. I thought I was going to die. And I'm like, yeah, that's not the right thing. It's going to put your system in a stress mode. It's going to make it way worse. Yeah. But I think it does. I think there is something to it. And I have had a few patients in combination with acupuncture because I advised it, but more so they're working with someone else and say, okay, I'm going to try this. What do you think? I'm like, okay, go ahead and try it. And probably the acupuncture and the support they were having with that then made it happen.
That's it.
How about food? What do you guys do with food? Is there certain things that we should avoid eating to sleep better, or certain things we should eat that help us sleep better? Things like that. Well, Daniel, you want to?
I mean, the most basic stuff, and probably Damiana's more versed in this than I am, but it's essentially laying off carbs at night because they turn into sugar. If people wake up in the middle of the night and they get the munchies, I tell them have a little piece of chicken available or maybe a handful of nuts. Again, laying off the things that people want to eat, which are the sweets. Essentially, it's a whole conversation because lack of sleep also impacts on our desire for food, and lack of sleep is catabolic, which breaks down muscle fat. So it really is important that we eat well in order to sleep and sleep well in order to eat, and in order to eat appropriately, and to be able to, if people are wanting to lose weight, one of the best ways is to get a good night's sleep, which didn't quite answer your question.
We'll get to that in a second.
Sure.
Damiana, go ahead. Anything more precise, or are you just good with Daniel's answer?
That plus I oftentimes do an elimination diet with them, which can be hard, but I have the most wonderful patients that are willing to do it for 30 days. We eliminate sugar, alcohol, caffeine, corn, eggs, dairy, gluten, and I think that's about it. Sometimes I eliminate beef as well. So just a kind of a typical elimination diet that I've learned in my functional medicine program, because I want to see if some of those common allergens will causes an inflammatory response in the body. That's not everything, but it's really helpful actually. And then we introduce things, and some people definitely notice things, certain foods. They notice other symptoms, but also insomnia getting worse when they reintroduce things. We introduce them every 3 days, one food at a time.
Right. I second I have a 21-day elimination protocol as well, and it's really helpful on a lot of levels.
I'm going to lob Daniel a softball here, but so I'm going to lob you a softball here in a second. But so I see a completely different patient than you guys see. Most of my patients don't sleep because they run out of time, or they think they run out of time, right? They're the super driven, the reason why they're seeing me is because they, worked out for 20 hours last week and their foot hurts, so it's not that they're not sleeping because they can't, although some of them have that problem, but a lot of them, don't sleep because they're just, they don't think they have enough time. They're too driven. So one way of motivating people who are just not sleeping would be to talk about weight loss. So how does sleep affect weight loss? Either or how does it help weight loss, or how does it hinder weight loss if you're not sleeping? Daniel, you basically set yourself up for that one. So answer it.
Well, let's put it this way. Lack of sleep is catabolic, therefore it hinders. Well, it's a big topic, and let's just say if you're not sleeping well, it's harder to lose weight that you want to lose weight. Okay, I'll leave it at that. We've got all these hormones, leptin and ghrelin, and so lack of sleep makes you hungrier and diminishes your satiety, I think the word is, your satisfaction. So you've got everything going against you, on top of which it breaks down muscle mass. So if you're trying to work out and you're not sleeping well, everything's working against you until you can start sleeping better. I'll kind of leave it at that.
So leptin and ghrelin are the kind of the two things that moderate your insulin levels, right?
Yeah.
I can't remember which one is the one that helps like get rid of it, and one, or sorry, is it insulin levels, or it's your satiation, how much you want to eat, right? So one of them makes you more hungry, and one of them makes you feel full, right? Right. Is that basically what they do? So if they're out of whack, and one of them's like, you need to eat like crazy, and the other one's not limiting that, then you say your thermostat on your furnace is all out of whack, right? You're like eating all kinds of food.
You just want to eat. You just want to eat.
Yeah.
Funny that you can't remember, because I used to have the same problem. I'm like, which was which? And then
this is not my world.
You remember ghrelin because it's like a growl.
That's why funny. For me, it's gremlin. So it's like the gremlin wants to eat.
That's the one that makes you want to eat. The other one makes you feel like you're full. Okay.
And so also when you're sleep deprived, I think it's as I was mentioning at the beginning of my lecture today, is a protective mechanism. If you're not sleep for whatever reason, the body says, okay, there is something wrong. So we got to store fat because something is wrong. The body is stressed for whatever reason. It doesn't matter if it's an imaginary fear that you have about the next day, or if there are hormones that are out of, they're imbalanced and such. But the simple thing is the body feels like there is something wrong. Better store fat to prepare for the problem. There might be famine coming up, which that's how we're designed, so that's kind of the basic thing, but obviously it's more complicated than that. So.
Do you guys send people to go, like, do you guys recommend some, that must be in New York, that
where else?
Possibly be in Boulder.
No, it's Boulder. It's got to be Boulder.
Do you guys send people off, or do you guys send people to doctors to go get sleep? Like, do you recommend that? Like, is that part of what you do? And I know you're talking about sleep apnea, and you created a whole thing for people to go read, Damiana, but is that something you guys are doing?
Definitely.
Hello? Somebody?
That handout kind of has some questions that you can ask your patient just to make sure. And if you suspect it, you are the practitioner that sees these patients way more than their medical doctor. So you have the opportunity to catch it and help them out. And so, I tell them to go to their primary doctor to ask for a sleep study. And nowadays they do the in-home sleep study. It's not even that expensive. It's a few $100s and usually paid by insurance. And that's definitely a thing that I missed a lot. And a lot of my patients, maybe because I live in Boulder, 90% of my patients that have sleep apnea, they're not overweight. So let's just forget that part. There are plenty of people, perfect weight. You look at them and you know way they can have sleep apnea. So I explain some of that in my handout. So you can sign up for that too.
Yeah, I do this. I tell people to go get a sleep study as well. I do so also with apprehension, I must say, only because that gets people onto CPAP, which is a whole other set of issues. I find that it's another way of tying them into the medical system, and while obviously it can be fatal if not looked at, certainly dangerous. In New York, you get a lot more people who are heavy, and so that is my first line of offense, which is to see if we can work towards weight reduction. I do use hypnosis. I use TAN has a protocol, or there are a few different protocols for sleep apnea, and I've had some success without going the Western route. But if somebody's really struggling, yes, I tell them to get a sleep study.
All right. I don't remember how long this is supposed to go. I think it was supposed to be an hour and a half, which we're rapidly approaching. But we got a ton of questions. You guys are way more interesting than I was, because I had like 3 questions by the time I finished my lecture last week, or 2 weeks ago, whenever it was. So we got a ton of questions here. So I'm going to just roll through the viewer questions here. Damiana answered some of them, so you guys can go back. But what do you guys think about smartwatches or some sort of device that's monitoring people's sleep? Do you guys have your patients use them? Tell your patients to avoid them?
That's cool. I tell them to avoid them. I tell them to only because it doesn't really do anything. It does not help them. It makes, in my experience, it tends to make people a little more obsessed than they already are, and without giving them a, it's like, oh my God, my Fitbit tells me that I only slept 2 hours last night. What am I going to do? And in fact, what people, when they do sleep studies, what they often find is they sleep a lot more than they thought they had been sleeping. So just personally for myself, I bought a Fitbit because people were asking me about it. And after about 4 days, I said, done. Not for me. That Damiana may have a very different perspective.
Yeah, I had an Apple Watch for a while, and when I first got it, I was like, oh, so excited! I'm gonna see what my sleep is like, and then, there's no way I could sleep with that thing. It just, I'd wake up in the morning, and that's all. It just caused me more stress about sleep, and I wasn't having any trouble sleeping at the time, and it still caused me stress about sleeping. So, Damiana.
So if they come in and they're already using it, I said, that's great. I make sure their phone is on airplane mode during the night. So there is not a constant communication between their watch and the phone. And then I tell them, I watch their attitude because that's very important. Do they over rely on it? We just kind of look at it, and it can serve as a gradual, they can see the improvement. I've seen that over and over again. It's kind of exciting for them. And I explain that they're not totally accurate, but what they're accurate on is the difference. So if this is what has been happening over the last few months, and this is what's happening right now, then we can use it as a comparison. I also ask them to do their sleep log in the morning before they look at that, because then that's compare what is their perception of sleep, which is helpful for me, and also what they're seeing in there. If they want to keep it. If it drives them crazy and it's causing problem, say, let's just drop it. But I also never advise anyone go buy one. So we just go with the flow a little bit. So, but I kind of like them when they have them and the patient is not stressed, because it plays in our favor. When they improve, they can see it and they come in excited. It's like, I got to show you this. I got to show you this. I'm like, show me.
Well, it could be good reinforcement, right? If they're seeing their sleep improve and their watch is tracking it, and all these records of it, it could be helpful, It's like, so that people don't come into your office after getting a whole bunch of good sleep and be like, yeah, I don't really feel that different. It's kind of like when, pain is dropping and people are like, oh yeah, my ankle really still hurts. I don't understand why my ankle still hurts. You've treated me 4 times. I was like, your chief complaint when you came in was your shoulder. We're on to the 3rd injury, but you're still complaining.
Right.
So it could be helpful in the whole helping, people track things as long as they are getting better, but maybe you could have them wear it to sleep and then have them not look at it, just send the results to you and have them not get a chance, tell them specifically not look at it. Then you can see what's going on.
People are very,
especially in Boulder.
People are so obsessive about this.
It seems like a good idea, but I don't know if you could do it. So you mentioned like Wi-Fi and stuff like that, Damiana. What's going on there? What does that do to your sleep?
Oh gosh, that's another subject that I'll probably spend a lot of time talking about that. But I mean, in the way I explain it to my patients without going into the science is like, we've been on this earth for a long time, and we have all these different magnetic, electromagnetic fields that are aligned with us, and suddenly now everything is different, it's higher, it's more intense. So you just think about that, like, is that normal? Do you think our body can adjust within like 50 years or 100 years to those? Probably not. So it's better to do whatever is within our power. Like, I don't know, like I use a timer on my Wi-Fi, so it turns off automatically at night and turns off back in the morning. So, which is kind of nice too, when people say, well, I do one more thing, and if they have the Wi-Fi shut, and when it makes them stop, you can go and switch it back on, but it takes a little bit of effort and it makes you think, and such. And also, I also find with people that are really ill, like the people that have that I mentioned earlier, the reactivated EBV or mold toxicity or Lyme disease in that area, they have what we call the chronic inflammatory response syndrome, and then they start reacting to everything. It's like one of the books that I read, they call them the canaries. You know how they use birds in the mine when there is a
yeah, canary in the mine. Yeah,
those people are the canaries. They tell, like, they're so sensitive, but that tells us something, right? So those people, they're not crazy. When they walk in and they say everything affects them, they're not crazy. They feel like that, even though they look like they could be crazy, but they're not. So yeah, some people are highly, highly sensitive.
So we got some questions about light. What do you guys recommend for bedroom lighting? Also got some questions about sound. So if you, what do you guys do about sound? Probably a bigger problem in New York than it is in Boulder.
Sure. Well, in New York, it's earplugs and eye masks. But you know, people sometimes do like the sound of streams, bubbling streams, like waterfalls, nature. If that helps somebody sleep, I can't personally imagine how hearing sounds can help you sleep, but it is certainly calming. So if it takes you to that first level of reducing anxiety, that can be very helpful. And yeah, getting rid of all light sources in the bedroom is crucial if you have problems sleeping. It really is. It really messes with the pineal gland to have any light source, and so you really have to, you know, put over all your, you know, your alarms, your anything that can create a light source, any sort of light, like the tiniest one, the tiny little blue light emitting from the TV is messing with your.
Oh, that thing! I can't sleep in a room that has a blue light on the TV.
Right.
I have to get up and cover that thing.
Right.
Damiana, how about like reading off an iPad before you go to sleep, or do you have them put any certain lights in their rooms, or do you have them wear the light filtering goggles or any, you know, things like that?
The goggles. I just listen to the patient because they can sense if they're bothered by lights or not. You know, definitely eliminate those devices if possible. The hour before sleep. Read books if possible, but I feel like the Kindle is not that bad nowadays. They're better and better. So there are also those blue blocker glasses. And then talking about light, the opposite of that, especially in the winter, I find those 10,000 lux light boxes in the morning to be so helpful. Some people have a tendency towards low serotonin, so then the melatonin is low in the winter and they get depressed. They have the SAD, the seasonal affective disorder. But what happens when you stare at that light, give you a little perspective, like when you're in a regular room, it's like, depending if it's a little sun or not, anywhere from, you know, 1,000, 2,000 lux, sometimes even worse when you're in offices, very little light. Sun, it's about 100,000 lux. So see the gap. But those light boxes that you can buy from Amazon, they're usually around $100 or even less. Mm-hmm. They give about 10,000 lux, and looking at them, or not straight at them, but actually a little down in the morning for 20 minutes, it's amazing to regulate the circadian rhythm and kind of encourage that serotonin and melatonin production, especially in the winter. Yeah,
when we started this, I had my two, like, you know, video, you know, super high powered lights on me, and halfway through this thing, I was like, wait a minute, I'm not gonna be able to sleep tonight. I mean, lights shining on me right before bed. So I got up and turned my lights off. So. Yeah. Also having caffeine I had caffeine once in the last 3 weeks. That was when I taught my webinar a week ago.
Oh.
And I paid for it. Like, it messed my sleep up that night. Well, I think a lot of things. My computer also died in the middle of it, which didn't help. But caused me a little bit of stress. So somebody asked about catching up on sleep. Is that a thing? Is that possible? Can you sleep 5 hours, you know, night all week and then sleep 15 on the weekend and catch up? Is that possible?
Well,
I don't think that's. Go ahead, Damian.
No, I mean, science says that it's not. So if we're to believe what the scientists tell us, that there is no catching up. That said, I do believe that if we take care of ourselves, we do with self-care, we can get back to a state of homeostasis. So I feel like it's kind of asking the question in the wrong way, because it's sort of the answer is one of doom, which is no, you can't catch up. the big picture is you can always catch up if you're actually taking care of yourself in other ways, so that you know, if you're not stressing constantly, you know, sure, it's, you know, you lose a few hours sleep. If you're really taking care of yourself and you know, making sure that you're, you know, if you meditate, if you go out and doing something great stuff for yourself, you're catching up in other ways.
Anything to add to that, Damiana?
Yeah, I would say if you haven't slept well for 10 years, you can't catch on all that sleep. Obviously, there are side effects and not so good after all that time. But if you, when you do start sleeping better, or even if you just one night or 2 nights, when you do sleep, you sleep deeper longer. That is the body's way to catch up on that sleep. The other thing that it's kind of a long subject is naps. Actually, I have an article, I think it's a great article on my website that I talk a lot about that. I'm a huge fan of naps if it's done properly, the way it should be done. But no, seriously, it really
So
works.
what's proper? What's a proper nap?
But very briefly, again, you can go to my website because it's a long article. It's like, I don't know, 3,000 words or something.
Like 20 minutes or something like that?
Yeah, no, but yeah, 20 minutes, 20 to 30 minutes. I ask people to put a timer for 40, 45 minutes. Between 1 and 3 o'clock approximately, or approximately 8 hours, 9 hours before they plan to go to sleep. And it doesn't matter if they fall asleep or not, as long as you lay flat. I think the kinichi and it's replenished. And as long as they lay flat and they're relaxed, even people that say they've never been able to nap, they say that they're able to relax. Eventually, they do doze off a little bit. I really like that for people that are really sleep deprived, because you know, when you're sleep deprived and you're trying to sleep, it's like if you've ever watched a child when they're overtired, they're just like they're just so wired they can't go to sleep. And adults are similar. So having that nap done right in the middle of the day can be really full, because it takes a lot of energy for the brain to fall asleep and stay asleep. The brain is busier at night than it is during the day, if you can believe that.
Right.
Aspects.
All right. So I think Jeff is going to knock us off here in a couple minutes. There's a lot of questions. I'm sorry to all you people who didn't get to answer your questions. Can I ask one more question, Jeff?
Yes, you may.
That was the question. No.
No. It's not like a genie here. How about people who have difficult work schedules where they can't, you know, go to sleep at a normal time for somebody to go to sleep? You know, maybe they work 12-hour shifts, or they work midnights, you know, something like that. Do you think they should keep a consistent schedule? Do you think they should, you know, change, you know, each time? How do you guys, I know that's probably a half an hour question.
It's a big question. And the simple answer is yes, to find that time where they can actually, if they need to get to sleep at 8 in the morning, okay, if they have a midnight shift, get to sleep at 8 in the morning and try to get those 8 hours. Put everything aside, tell everybody to go F themselves. You need that time, and be very careful with maintaining consistency, even if you have to, you know, if you need to get up at 6 in the morning, you can get to bed by 9. You know, try and get to bed by 9. If you're just getting home at 8 and you need to, you know, eat and talk to your family, then, you know, make sure it's 9:30 or 10, but be consistent. Yeah.
So I think I was trying to find that question where it is. Somebody actually had a specific question.
Yeah, you want me to read a specific question?
Yeah,
what do you suggest for an RN with severe insomnia that works 11 a.m. to 11 p.m. 3 days a week? She sleeps 2 a.m. to midday, but on her days off, she sleeps earlier. It's part of its cutoff. I can't see it. Do you suggest she keeps her schedule consistent, or, you know, she gets to sleep earlier when she's off?
I think keeping consistent is really important, but also just from reading that question, I could see how it can be shifted a little bit. First, she seems to be in bed for, I don't know, 9, 10 hours. That's too long. So we got to get her down. I like to think in healthy people, we sleep in 1.5 hour chunks. So that would be 7.5 or 9 hours. So let's say 9 hours. She maybe needs more. So 9 hours. And then the second thing is she gets home. I don't know how long it takes her. It's hopefully 11:30 midnight. Like if she could try to get home, like go to sleep at 1 a.m. So 1 a.m. plus, you know, she could have a longer morning, actually. It's possible, and definitely stay consistent. Definitely. You can't do this yo-yo that really affects the body.
Now, and that is a place where napping can make up the difference. Again, it's a tough one, but yes, a good nap for somebody. I mean, I've got a couple of patients who have crazy schedules, and I'll tell you one thing with COVID. This one patient, he's now working from home, and he is in ecstasy because he actually gets to take a nap in home within between two chairs at work, and so he's doing better than he was. Let's put it that way.
All right. We have more questions. I would keep going, but I think we've run out of time. Can they answer these somehow? Like,
I can send out the leftover questions, and we can share them on our blog with the recording afterwards. So if you guys are comfortable, I'll send out the questions once we end. Actually, I'll do it tomorrow,
Sure.
since it's getting a little late. But
Yeah.
I want to thank all of you guys. So, Damiana and Daniel, you guys did such a great job presenting, and I know it wasn't, something that you were super comfortable with, but you did a fantastic job, and it was incredible. Chad, thank you as always for moderating, for asking such great questions and doing such a great job. Please, everybody, check your email afterwards. I did share all of the links that are in the email throughout the course of the night, but also everything's there. So there are links to Daniel's handout, to Damiana's handout, to Chad's class, or he's being interviewed tomorrow on Facebook Live by Matt Callison and Brian Law, sorry. And
you're right the first time,
Lau, sorry. So my apologies, but so just check your emails after this for all of this great information. I feel like we could have had 3 webinars just from this one webinar. It wasn't fair to make you guys do that 20 minutes. So hopefully we can work together again in the future, maybe do something as a continuation.
Sounds great.
Nothing else, we could knock off a podcast or two.
Do we ask for 10 grand on the next one, Damiana? That's what Matthew Walker wanted.
So on that note, thank you, everyone. It was a wonderful evening. Thank you, our speakers. Thank you, our moderator. Everyone have a great night, and we will see you on Thursday with Mary Elizabeth Wakefield for Miss Emotions and COVID-19. So don't miss out on that.
Great. Thank you, guys. Thanks a lot, guys.
Have a great night. Thank you.
See ya.